A couple of things just to remind folks of, as the county executive mentioned, we've talked about this in a number of our briefings over the last couple of weeks, that we've had a number of days where we've seen decreased test volume in terms of the tests being resulted, and we're starting to see that become more common. So for example, yesterday, the test count was out of a little bit over 13,000 tests resulted. Today, just shy, a little bit over 12,000. So we're continuing to monitor that trend, and we're continuing to try to understand what's driving that. And that's not only, necessarily here locally, but across the state, to get a better understanding if it's a question of access to testing fatigue, or people just simply aren't showing up to get tested based upon any of the recent conversations about guidelines. And so it's important to understand when we look at the total number of results resulted, we also look at a host of those other measures, test positivity and the number of tests that it is out of. Now, another thing I want to highlight, which we've talked about before, is the percentage of cases in the younger groups, the 0 to 19-year-old age group. In Montgomery County in August, we saw approximately 19% of our new cases who were in that age group. And in fact, of the results that were reported this morning, we saw over 22% of the new cases reported today being in that 0 to 19 age group. And this is on the heels of a study that was released in the New York Times on August 31st that talked about and showed the number of cases in the pediatric age groups since May through August. And they actually showed that the number of cases in children increased by 720%, the number of hospitalizations increased by 356%, and the number of deaths increased by 229%. So this is not to scare anyone, but also to, again, remind folks that we are seeing more cases in our younger age groups, not just the 20 to 30-year-olds, but also those school-age children.